So I think it just leaves me to introduce Linda Harper. And Linda Harper is our Associate Nurse Director for Practice Nursing and Lead Nurse for the Moray IGB. So I will introduce you to Linda. Thank you.
Okay, thank you very much. So welcome everybody to the Celebrating Advanced Nursing and Midwifery Roles. I think this is really exciting. I've spent a long time, I have to say a nurse practitioner role is my background, not so much specialist, but I know there are both here today. I think our roles are similar but different. I would say I'm a generalist, and I would say as a specialist you specialise in one area, but that might be something that we can have a discussion around later. But I think in terms of nurse practitioner, I've spent a long time since the mid-90s trying to get this role recognised and get a good education programme behind it and a good workplace-based learning programme behind it too. So the aim of today is that you can learn a little bit about the national work that's going on. Karen, I think, is going to present the preliminary findings of the NHS Grampian survey, which I would expect most of you have been involved in. And I suppose just a bit of to understand the different roles that we do have, and in this changing environment, because it is changing, and probably because it's changing, that's opened up avenues for us and opportunities for us as nurses, which I think we need to grab, and especially now as nationally. There is a real impetus for us to grab developing roles. And also a real opportunity for you to influence how you want your work to develop, your education to develop, in order for you to deliver excellent evidence-based care to the population of Grampian. It's also a really good opportunity for networking, and sometimes actually that's the best thing that comes out of a conference, isn't it, is the networking. And I suppose we've got the opportunity to extend our role, but we also need to ensure that we are really professional in our roles, otherwise it's not going to work. We need to evaluate what we are doing, and in order that we ensure we are delivering best care for the patient, and it is an evolution that is working and that is needed. And I suppose my background, I was a district nurse, a midwife, a health visitor, and then I went into practice nursing. I was really keen on the nurse practitioner role. I was really keen that I completed a nurse practitioner degree programme. In the mid-90s, Abertay ran a programme, didn't last because there wasn't the need. I was given the opportunity to develop the out-of-hours service when GPs were given the option to opt out of delivering out-of-hours care. I'm thinking I'm going back to night shift and unsocial hours, but I was really keen because I thought it's an opportunity to develop an education programme. The Abertay programme finished, so we didn't have an RCN accredited programme up here in Scotland, so I worked with RGU and we developed that. We had the medical school delivering the clinical examination skills and the history taking. We did pathophysiology because I really wanted a clinically based degree programme. And I also wanted a robust in-house programme because I suppose I had felt a bit vulnerable myself. And I think it's been a bit haphazard across most health boards, really. But now is the opportunity to get something set in stone. And I know in terms of specialist nursing, there's been work done, I think it was around about 2006, was it? Or 8 or later. 10 around the specialist role and what the specialist role is. I think government worked on that. Nationally, there is the Transforming Nursing Roles, and the CNO is looking at all roles. She's looking at the district nursing role, the health visiting role, which is completed, children's nursing. She's looking at advanced practice. Don't know that specialist nursing has been looked at specifically, but again, there's an opportunity to influence that because now is the time to do that. I'm on the Advanced Nurse Practitioner group, and Eddie there chairs that group. The first phase is completed. I don't know if you've all seen the paper. I've certainly sent it around. The phase 2 starts, I think our first meeting is the 15th of September, isn't it, Lady? So we are progressing apace. So really all that I would say is take this opportunity today to, to think about what you would want in your roles. If your roles need to change or if they don't need to change, is the education right? Is the support right? I know there are constraints in terms of time, money, but actually if we and you put the work in, you will be, you're much more comfortable within your role. An advanced nurse practitioner role, especially out of hours, and I see Sheena here who works with me in the GMED team. It's those of you who are in that roles, they are quite scary, aren't they? And I think you need the education and you need the workplace-based learning support to develop. And hopefully we can get some ideas from yourselves and what we should be doing in Grampian to support and develop these roles. And that's all I really want to say, except enjoy the day.